As the festive season gets into full swing, the South African National Blood Service is once again gearing up for its annual blood drive. The spike in traumas such as road accidents during the season only put more pressure on the already less than 1% of the South Africans who are blood active donors.
To speak to us about the blood drive and other donor initiative is Internal Communications Officer at the SANBS at Nomfundo Dlamini. Nomfundo, good morning.
Good morning.
Thank you for joining us. So during the festive season, how much more blood do we need than, say, during the year?
I think, sure. Normally we need at least 5 days blood stock, right? So we need about 5,000 units of blood a day in order for us to be able to maintain the blood levels just for the country. What does happen though is that during the festive season we take a bit of a dip. Currently we are on 5 days stock, but anything can happen based on the trauma cases we might face during this particular festive season.
So 5 days is what we need just normally?
Yep, on a day-to-day level.
Okay. And how often are we at that 5-day level?
So this year has been a good year for us, and I think that's thanks to a lot of South African donors who have actually been coming in and just making sure that we have enough blood. But usually around the winter seasons and festive season, our levels drop to at least 3 days, which isn't good because the moment we reach 2 days, that means we're in crisis.
And what makes it even worse, I imagine, is the fact that during festive season, there's less people that are willing to go out there and donate blood, or people have less time to do the responsible thing like that, because maybe they're out partying?
I think besides out partying, I think people have gone home, people are in areas where we more or less don't have the blood drives, you know, or the donor centers, whereas most people who are in the city center, or maybe at least in KZN, it's easier for them to access those blood donation drives or donor centers. So I don't think it's because people don't want to donate. I just think that at the moment, some areas aren't accessible enough.
And so in terms of stockpile, how much blood is it that you guys can handle if you had donors that are willing to come through?
I mean, like just right now, this year, I think we've gotten at least 4% increase on our blood donation, which is massive. So I think we can handle as much blood as we can get. So we're at a point where we'll never say to people, no, we don't need the blood. We always need the blood.
What was different this year? Was it about, did you do something different with your messaging? Did you go to more places? Why was there, I mean, you're speaking about, is it a 4% increase? What was different about 2019?
So in 2019, what the marketing and medical division decided to do is actually just change a few questions in our donor questionnaire. So I think there were questions that a lot of people found were highly intimidating. I think mostly the lifestyle questions just around your partner and whether they have multiple partners. And just changing those questions, I think has actually had an incredible impact on our blood stock levels, because people don't feel invaded, you know. People also don't feel like you're asking me stuff that I just don't know about. People feel comfortable now, and they understand that it's really just about the blood.
And then in terms of repeat donors, how often do you get people who donate on a regular basis as opposed to just those that come in once?
So I think that might be our biggest struggle, the fact that we have a lot of people who are first-time donors. They present, they donate, but they don't come back, you know. Whereas we do have some people who've been doing it for years, but I think people just don't understand that once you start, it's almost like you need to continue doing it. You don't just come and then you drop off. But we're working on that as well.
Because I'll be honest, I used to be a blood donor, but this year I haven't donated at all.
Why not?
But why?
I have no idea. I haven't got a good reason. I've just been busy, I suppose.
Okay. In terms of what happens to the blood once it's donated, very often I see, well, it comes up on my timeline every now and again, people being surprised that the blood, at some point, there's a price attached to it, certainly when it gets used for trauma, etc. So once you've donated the blood, how then does it work? And at which point, who pays for it? Would it be the hospital? Would it be the patient that then receives the transfusion? How does that work?
Okay, so of late, I don't know if you're aware, but blood has become a prescribed minimum benefit. This means that if you're in a government hospital, the blood is paid for by the government. And if you are in a private hospital, then your medical aid actually does have to pay for your blood. It's not something that the patient is actually paying for. So what happens happens to the blood just in general is that the blood goes through a lot of testing and making sure that the blood is cleaned so that it can be transfused to another patient. And I think that's where the costs were involved in the beginning, where you'd find that if someone then is in hospital and they're not on medical aid, then it's not that they're paying for the blood actually. They're paying for the blood being cleaned, the blood being tested, and making sure that whoever receives the blood doesn't get blood that's infected with maybe HIV or even hepatitis B. So it's not that you're paying for the blood. It's just the services around the blood that ensure that the blood is clean.
And so if somebody's watching right now and they go, okay, I want to do my bit, how do they get to donate and how do they get hold of the closest SANBS office?
Okay, so they can actually check our website, www.sanbs.org.za. Over there, you can actually just search for your closest donor center. They can also go to our social media pages. Instagram and I think Twitter is at the SANBS, and on Facebook it's the South African National Blood Services. And they can DM us, even message us. There is someone there who's constantly responding to all their messages and can give them exactly the contact number and the location, even the address of where their nearest donor center is.
And who can donate?
So you need to be between the ages of 16 and 75 as a new donor. You need to weigh at least 50 kilograms and at least be healthy or believe that you are healthy. Obviously, we do run a few tests on the blood afterwards, but just to present for donation, you need to be between that age group, that weight, and at least trust that your blood is healthy.
And the frequency of donation, I think once every 3 months, if I remember correctly, but I could be wrong.
It's once every 56 days.
Okay, cool.
Okay. And are there any people who are excluded from donating?
So I don't think it's really exclusion, but we do now, especially in the KZN area, check people for their iron levels. So we might say that you are deferred based on us realizing that your iron levels are too low. But before, what we do is just turn you away. Now what we have done is we have an iron replacement project that we're running, where if we do realize that actually your blood levels aren't okay, then we are giving iron supplements to those donors in order to replenish their blood so that in the future they actually can donate. So I think this is one of the projects where the SANBS decided this year to say thank you so much to our donors, and we actually don't want to just take blood from you, but we also want to start giving back and making sure that your blood is actually in good condition. In as much as you're giving, let us also give something back to you to take care of your blood so that you